Hi, I'm Michelle. I'm the Adult Services Librarian for the Inglewood Public Library. Today we are doing a presentation on 11 ways to handle burnout and stress while caring for your loved one. This is provided by HomeWatch Caregivers, and our presenters are Mindy Sterling and Roger Rhodes. I'm going to turn this over to Mindy and let her take it from here.
Hello, everyone. Welcome. Thank you for coming. We love as a company to be able to provide as much information and education to folks out there that are standing at a crossroads, that they need to know more about their loved ones and perhaps what might be going on that they understand or don't understand. I am the Education Director for HomeWatch Caregivers, have been for a decade or so, and I started out as a caregiver. And one of the things that are near and dear to me about this particular presentation is that having been a caregiver, there were many things stress-wise and overwhelm-wise that I didn't know what to do about. I didn't know who to go to or where to get information that could ease that. This particular presentation is by my boss, Mr. Roger Rhodes, who owns HomeWatch Caregivers of Denver, along with his wife, Darby, and has personal experience with being a caregiver with the parents and their family. So we try to come from experience and give you some tools to get back into the servants at heart that we try to be when we're offering our help and assistance to our loved ones. So I introduce Roger Rhodes.
Okay, great. Thank you, Mindy. This is Roger. We are coming from two sets of experience. For 7.5 years, my father-in-law, who was a retired doctor, had Alzheimer's and stroke issues and lived with us in our home for 7.5 years. So we experienced family caregiver burnout and stress for 7.5 years, and then for 20 years, our practice HomeWatch Caregiver has been helping people get hope and help for their loved ones. So let me advance this slide. Did I go too far? There we go. Just some basic background. Caregiving burnout is real. If you have care for a loved one and your neighbor across the street isn't caring for a loved one, your stress can be 30 times greater than that non-caregiving neighbor. So it's real. It does take a toll. This bottom bullet is about spousal caregivers. 62% of the time, the health of the spousal caregiver will suffer equal to or greater than the original spouse they were caring for. So it does add up. You do need respite. You do need a break. This has gone so far over the many years, and now there is a medical term called caregiver syndrome. It's real. A neuropsychiatrist in Baltimore developed a term, and it's defined as debilitating condition brought upon by unrelieved, constant caring for a person with a chronic illness or dementia. But there is good news. There's ways to mitigate this and stop the caregiver burnout. As a caregiver, you need to give yourself permission during the day to take a break, to take a rest. You'll be a better person for it, a better caregiver, and accept these feelings. The feelings that you go through commonly are, why me? I didn't sign up for this. It involves anger and fear and resentment and guilt and feeling helpless, and then grieving about those losses in the loved one you're caring for, losses of part of your life. So to start part of the 11 ways to stop caregiver burnout, the little voice in the back of your head, you need to talk back to those negative thoughts that we talked about earlier. Get involved in life, look for some self-help. Journaling has often been very therapeutic to keep a record of what's going on, sharing that with loved ones, looking for help. So there's family help, there's professional help. We're going to go in great detail on those. There are consult your doctor, there are supplements that can help. And be good to yourself, be patient. Don't be so hard on yourself. Have a friend, maybe now in environment we're talking about, it's on the phone or it's Zoom. Find time for a project, just something to stay busy, keep your mind occupied that is not totally focused on caring for your loved one. So there is help. Realize that caregiving is a job, and you've earned the right on this job to get a break, to have some respite. In our communities, there's an entity called Area Agency on Aging. You can go there, and they're a wealth of knowledge of Central Clearinghouse for information. Michelle in the Inglewood Library System is a wealth of knowledge, and there's a list there of some other things, both local and county. For veterans, I know there's a lot of veterans that we see and take care of. There's a lot of veteran programs that are free. There's a lot of income and pensions that people don't know about. One is called the Aid and Attendance Pension. It's tax-free money. You don't have to have any service injury. It's with a spouse and veteran. It could be over $20,000 a year, tax-free. So if you need any more information, we can provide that to you offline. And then other affiliations, whether they're the Elks, the Eagles, or places of worship, are good sources in normal times for support. Mindy, you want to talk about telephone passive and active? Are you comfortable with that?
Sure.
I can take this one if you like.
Please.
Okay. Just on an overview, there's telephone check-ins so that family members are reaching out and not being isolated. And in our practice, we have what we call passive and active calls by families. We accept calls into the office just to talk people down, and there's also a setup where we have active calls. Well, we will call them and reach out if we haven't heard back from them from time to time, to make sure that they're not being the Lone Ranger and being too isolated. Friends and family, that's the first line of defense usually. With friends and family, there's a demand on their times, so we may have to go to volunteers, and this last bullet is something we highly recommend. It's a website called Lots of Helping Hands. It's a website, it's free, it's private, it's protected. It brings together a village, if you will. We had a gentleman whose wife had MS, and he would put out a monthly calendar, probably 2 weeks into the month for the next month, on Lots of Helping Hands, saying, Tuesdays I need help with grocery shopping, and Thursdays can somebody relieve me so I can go back to the office. Shower help, whatever he needed, he would put out on his calendar. And with his coworkers, with his neighbors, with his families, with some people at the MS Society, by the time the first of the month hit in that 2-week period, all those things he put on the calendar were filled up, because it does take a village to help people get through, especially with a chronic disease or a progressive disease. Emotional support. Besides the physical support, emotional support is huge. The old adage of trouble shared is trouble halved. So don't go through this alone. There's got to be a trusted friend or family member. We'll talk about support groups, counselors, therapists, and there's always faith-based help. On support groups.
I can chime in about this particular subject matter.
Fantastic.
Support groups, sometimes the last thing we want to do when we're tired and we're stressed and we feel like we want to isolate and be able to process and handle the things that are on our hearts and our minds, the last place we might want to be is in a group of people, or in a group of people that we don't know. And that's totally normal. I would encourage anyone, if that can happen online, but if there is a support group that you can find in your area, go just try it once. If you don't like it, you never have to go back, but I've run several of them, and many times the bonuses from that is you're around people who understand exactly what you're going through, and their input and their sharing can be extremely healing and helpful when we need connection. We need to know that we're not alone. Back to you, Roger.
Okay, so what the next one brings us. Do you want to talk about the community support groups also? Or I can take that, whatever
Go ahead.
you want to do. On the community support groups, these are people that are nearby in your community, maybe at rec centers. When things get back to normal, face-to-face contact is really, really important. But the thing about taking care of yourself, you need to get out of the house, have some kind of outlet, so you don't feel like the Lone Ranger, you don't get isolated and feel like you're the only one going through this. So these support groups, they may be community-based, they may be disease-based. I know they're very good support groups here in the Denver metro area for Alzheimer's, for Parkinson's, for MS. And not only will you benefit, but somewhere in the disease process, perhaps you can help somebody that's behind you in the disease process. So there's help to be received and help to be given. In this day of internet, some, like Mindy mentioned, don't want to be in front of other people. So you can jump on the internet and there's support groups, and these are worldwide. And we found these years ago where there's some pretty rare disease process out there where there aren't enough people in the Denver metro area for a physical support group, but online with some of these diseases, and for folks who just don't want to go face to face, these support groups are a great outlet. Good for people that don't drive anymore and have transportation issues. So we recommend researching those, and if there's help needed, we can provide some of those resources. Mindy, this is yours.
Oh, halt. Oh, you know, this particular acronym saved my life. And at first I thought it was a little corny and thought, oh, I don't need this. And I found myself trying to remember it at times, going, what was that? HAIL? Was it hair? What was it? HALT, and not to become too hungry, angry, lonely, or tired. And within any stressful situation, in the caregiving world especially, had to make sure that I was eating on a regular basis. And I don't mean donuts and coffee first thing in the morning and all day, but actually eating something that kept my equilibrium in a good place. I had to check my caffeine intake too, and make sure that I wasn't becoming too stressful, because I was trying to be reasonable and happy with a lot of Starbucks. Being angry is very draining. The why me feeling, or if you're in a family where you're the caregiver and there's no one else around, you're the daughter, the son, the spouse, or involved where nobody's really helping you out, or you feel resentful. We were talking about those feelings that come with caregiving that we tend to stuff because they feel inappropriate. They are not, but that to process them is really important, because as Roger was saying, the ramifications can be that we get very, very sick. Stress is one of those things. So check if you're angry, check what you're angry about, see if you can talk yourself down off of that or table it for another later. Being lonely is not talking about our stress, our isolating, and our no social life outside of work. Yes, finding an outlet, whatever you're comfortable with or mildly uncomfortable with, because lots of times that's where we need to be, and then it offsets it a little bit because we get a hug or we get some acknowledgement. Tired is a big one. I know that when my mother was in our care, my sleeping habits changed. When I was supposed to be available changed. When the cell phone would ring, where I had to jump and run. Many things attributed to that. It changed my work schedule. Restful sleep is really, really important. And knowing where your comfort zones are. And it's really self-care, taking care of ourselves so we don't crash and burn if we really want to be there for the people that we're caregiving, the bottom line, at least for most of us, that heart intention is we really want to be able to be there for them. And if we're going to be, then we got to start with number one, and that's us. And that can be a little bit of a roadmap that we're trying to perhaps give you today. And that's what I got on that.
Great, thank you. Thank you.
You're welcome.
Some summaries, getting some options. Friends and family, the website we mentioned, lots of helping hands. There's help with caregivers that may be independent contractors. There's help with home care agencies, which do a lot of non-medical things. And then for more involved cases, there's home health agencies that are professional, that are on the medical side. We'll go through those real quickly. Pluses and minuses of getting a freelancer, a friend of the family, or an independent contractor. They will be less expensive than going through an agency. What you want to be careful on the con side is just checking them out. One thing we offer with a lot of our folks who have to go the route of a freelance independent contractor, can't afford a full-blown agency, I will do background checks for them for free. We do probably the most extensive background checks in the state. So you need to check them out. If you're employing them as a caregiver, you're responsible for taxes. So check out the tax situation. Check your homeowner's policy, this worker comp bullet. If they slip and fall in your home, they're a contractor, just like a plumber would be. Do you have coverage on your homeowner policy to cover any possible slips and falls or cases there? Taking a step up to home care agencies. These are non-medical. They do hands-on care as well as professional care. They help people get going in the morning, get dressed, get showered, toileted, meal prep, medication reminders, light housekeeping, errands, transportation. All those can be customized to whatever that individual needs, just to get the caregiver out of the house and recharge their batteries. So through these agencies, these caregivers are employees, and so they're bonded and screened and checked out by the agency, and that's a state law. Some of the pluses and minuses of using the home care. Some of the pluses, these are professionals. You can customize the care, and there's nothing better than one-on-one care. And you're the boss, so you're totally flexible with the scheduling. Some of the minuses, a lot of agencies vary around the state. We've got something called a make sure checklist we can provide that has good questions on how to qualify and these different agencies. And a full-blown agency with all their responsibility will cost a bit more than a freelancer independent contractor.
May I interject with something?
Yes, ma'am.
A lot of the times there's this hallway in between keeping control because we believe, and for all the right reasons, that no one is going to pay as good attention to mom as I am. No one knows her as well. She doesn't trust anyone like this. I'm the best person for the job, which is probably all true, but closes the door on outside help. On the other side, and then in that hallway of, I don't want to let go of control, some people find that when they do get someone to come in and help on a part-time basis, the pressure cooker of it gets alleviated. And there's a new window open to socialization and someone in the house, and it lightens the load. And I just want to say that that's a hard place to be, and people find themselves a lot. So we encourage people to try it if they can, and again, see how it works out, because we have found it to be very successful. I've been a caregiver at a home where the daughter hired me. I went in to take care of their mom, and she called the daughter within an hour and said, I want to fire her. And she says, nothing personal, honey. And I said, I didn't think it was. And I said, but we need to talk to your daughter because she hired me. And when we talked to the daughter, and the daughter said, no, mom, just please try it. That relationship went on for 3 or 4 years. And I became one of the more, the closer friend and an adopted daughter for this person.
Yeah.
So there can be some resistance, and I wanted to chime in with that. You know, it's a tough situation.
That's a good point, Mindy. There is what we call a resistance to assistance. And many times it's the person receiving the care. Many times it's, as Mindy pointed out, the family member who thinks nobody can take care of mom better than I. But they'll just try a little help from time to time. The point is, if that family caregiver goes down, what happens to the other family member? You're looking at a facility, and there's some pluses and minuses with that too. So let's take on the next slide. Payment options for long-term care. Vast majority of these payments are private pay, especially if we're talking about facilities. There is a growing use in long-term care insurance that pays for all of this. Occasionally we get some private medical insurance, some special platinum, gold, ruby, sapphire version of medical insurance will cover home care. Right now, something new on the horizon is Medicare is coming back. Years ago, it picked up a lot of this home care, and now Medicare Advantage programs, different policies are starting to pick this up. So that's something to check out with your Medicare carrier. Disease organizations have grants, have funds. I know many of you have seen the old bucket challenge from the ALS association, where they raised millions of dollars, and now you can fairly easily get $1,000 grant from the ALS group, Lou Gehrig's group, for respite care. And again, we mentioned earlier, there are veterans pensions and benefits. The most popular one that applies for this for home care is called the aid and attendance. Needs more information, we can provide that too. Never too late. Get started as soon as you can. Don't try to be the Lone Ranger. Get some help. Friends, neighbors, families, agencies, disease organizations. There is help out there to help you get through this. Take care of your loved one in the home and not burn out and become a casualty yourself. Mindy, any closing thoughts?
Oh, Mindy, you're muted.
Yes, I do, Roger. We love to educate, as I said, in the number that the 720-344-4700. We are always available to answer any questions and steer you in the right direction, depending on where you're standing and what it is that you need. We also have a caregiver burnout test that we give when we're live and in person, and that has a scoring pad on it. You may want that. If you do, get in touch with us. We'll be glad to email it to you, along with anything else that you heard today that you want for yourself, or perhaps to hand to